Hello, and thank you for joining our Fall PCLP Colloquium. The focus of today's discussion will center around women's reproductive and neonatal health. Women remain a critical part of the healthcare infrastructure, both as partakers of healthcare services and as providers. Today, our young physicians in training will underscore the critical role of women's healthcare issues in the healthcare arena while highlighting the importance of screening, access, and education. Thank you again for joining us. Enjoy the presentations.
Hello, my name is Nakia Burke, and I am a second-year medical student at Morehouse School of Medicine. I was placed at the United Neighborhood Health Services in Nashville, Tennessee for this summer's GE-NMS Primary Care Leadership Program. The title of my independent service learning project is Women's Health Services at United Neighborhood Health Services, Increasing Patient Education and Provider Knowledge of Supportive Community Resources. There were a number of objectives that I was hoping to address with this summer's independent service learning project. First, I was really interested in taking this opportunity to assess health education needs for the female patients who were seen at UNHS clinics, specifically in the Casey and Main Street family clinics. I also really wanted to gauge their interest in getting more information regarding various health education topics, but also gauging their interest in participating in women's health seminars or even free classes around topics like prenatal health. I also wanted to develop marketing and educational materials that were specific to women's health. Currently, these materials are very limited in all of the clinics to only one or two brochures and one or two flyers or posters. Finally, I wanted to develop a compiled resource book for all of the women's health resources that are available in the community for use not only by providers but also by patients. There are a ton of different resources that I found while I was working on my project this summer, but I didn't find any single compiled source that would be beneficial for providers to have on hand or also for patients whenever they were looking for different programs or different things that they could benefit from the community. There were two major methods that I used for this project: key informant interviews and a women's health questionnaire. The key informant interviews were conducted at UNHS, Casey and Main Street Family Clinic with staff and clinicians, as well as some community stakeholders from different programs and departments around the area, including the Department of Public Health, as well as the Martha O'Brien Center. There were 14 total key informant interviews completed, and we got a lot of really great information from those key informant interviews. There was also a 14-question women's health questionnaire that I developed and had distributed as part of the patient intake process. We utilized the Casey and Main Street Family Clinic specifically because these are two clinics that see a good amount of women's health services patients. We also distributed the questionnaire to alumni of a program called Tied Together. This is a parenting program that's offered at the local Martha O'Brien Community Center, which is really close to the Casey Family Clinic. It was important for me to distribute this survey to the alumni of this program because they're women who live in the community and have the potential to access health care through United Neighborhood Health Services. And I thought they'd provide a really great perspective and also really good information about what the interests are for women in this community. There were quite a few key findings that were pretty important and pretty surprising, although some were expected. First, 100% of the key informants indicated that Tennessee's failure to extend Medicaid has been the biggest challenge associated with provision of care and overall health for the community served at UNHS clinics. Specifically for women, there are a number of different issues associated with getting insurance, making sure that they're insured during pregnancy, making sure that their children are insured after pregnancy, and that they're also insured and have the ability to access care throughout all of their different stages of life. So this is pretty important for women and women's health. Also identified were the need for increased health education and outreach, as well as increased awareness about prenatal and preconception health and education about those topics, as well as increase awareness of community resources so that people can access healthcare but can also access some of the support services that they need to have really great health. From the questionnaire, we found that only 46% of women who had ever been pregnant were offered pregnancy-related educational materials. And this was for any pregnancy anywhere. But it kind of shows that there is a great opportunity to increase pregnancy-related education. So prenatal health education about, why it's important, but also, what to expect. 93% of our survey respondents had never heard of the Strong Start Prenatal Health Education Program, which is currently offered at United Neighborhood Health Services. It's a really fantastic prenatal health program, and this shows that there is a great opportunity to increase awareness of this program so that we can increase utilization. However, 75% of our respondents felt that education about prenatal health care and why it is necessary during pregnancy was important. So again, it's really good to know that everyone felt that, or a lot of the respondents felt that prenatal health education and really getting an understanding of prenatal health care was important, and there is this great opportunity with the Strong Start program as well as other pregnancy-related educational opportunities to increase awareness and education in this community. 39% of our survey respondents expressed some level of interest in participating in our free prenatal classes, as well as 66% who reported interest in participating in free, just monthly women's health topic classes, so general women's health topics, or some sort of educational workshop that would be held at the local clinic or community center. All of this guided the recommendations that follow. First, I thought it would be pretty neat to develop a series called Women's Health Wednesdays, and these would be free education sessions based on the survey respondents. They would be held at local schools, community centers, and even housing authorities to increase overall health knowledge as well as awareness of the services available at UNHS clinics and in the community at large. This would be a really great opportunity to address some of that interest in prenatal health education, but also just to talk about various women's health topics for women who are not pregnant or don't plan to become pregnant in the future. There's also a really cool opportunity to increase utilization of United Neighborhood Health Services facilities, having some of these sessions located at that facility, or even just being out in the community and letting people know that UNHS offers women's health services. This may really support community acceptance of what a lot of the UNHS clinics are trying to do with the patient-centered medical home model. And hopefully this will encourage more women to receive all of their health care at their local clinic or community clinic medical home, as well as making sure that they're receiving comprehensive health care for themselves and their families. This was a really great opportunity, and I'm really excited to have been a part of the Primary Care Leadership Program this summer. Thank you to all of the staff and everyone at PCLP, as well as all of the staff at United Neighborhood Health Services for allowing me to take part in this opportunity. Thank you all, and have a great day.
My name is Nicole Coppage, and for the second year participating in the Primary Care Leadership Program, I continued my work at AltaMed in Los Angeles on family planning practices and the role of pediatricians in increasing interpregnancy intervals among low-income women served by AltaMed. This project was initially developed out of an observation at the clinic that though parents bringing their children in for a 0 to 12-month well baby checkup had no desire to get pregnant anytime soon, neither were they utilizing effective birth control methods. Now, we know that short intervals between repeated pregnancies can have negative biological and psychosocial outcomes for both mother and child, and this has been well documented amongst adolescent mothers, who often have an increase in birth control usage postpartum, but rates of discontinuation are high due to lack of education, parental support, and loss of continuative care. While this has been well documented in the adolescent population, it was really unclear how pervasive this phenomenon was amongst all women in a low-income community. Many women tend to fall off of care because their care ends at 40 days postpartum. So we saw there might be opportunity for pediatricians to actually continue this discussion, this family planning discussion, during the 0 to 12-month well baby visits. So our objective was to understand how current family planning practices related to future pregnancy intentions in this population, and exactly how comfortable mothers were discussing family planning with their pediatrician rather than their OB-GYN. Our method was to develop a 19-question survey that we delivered to 21 new mothers during their 0 to 12-month well baby visits. And what we found was that though all mothers surveyed indicated that they did not want to get pregnant at this time, in fact, the earliest any mother wanted to get pregnant was 2 years from the date of survey, 41% also indicated they were not utilizing any form of birth control. They listed reasons such as lack of insurance, lack of knowledge about options, and safety as significant barriers that prevented them from utilizing birth control services. 67% stated they did not have a women's health provider, and 71% of the women surveyed stated they would like their child's pediatrician to offer family planning education. In fact, these 71% was entirely women who did not already have a family planning service that they were already using. So from this, our recommendations were that our survey indicated that patients were favorably inclined to speak with their child's pediatrician regarding family planning services. This suggests an important opportunity for pediatricians to educate their patients on pregnancy spacing and improving the health of their children, as well as actually linking them to care, either with a women's health provider, promotora, or OBGYN. So using these survey results, we hope to develop a short, culturally competent family planning intervention conversation for pediatricians to implement with new mothers, and determine if this simple family planning conversation during these 0 to 12-month well child checkups can actually increase the interpregnancy interval among low-income women in this population. Thank you very much for your attention.
Hello. This executive slide is on the identification of female patient decision-making factors when considering the use of the contraceptive implant. My name is Joseph Guillory, and I am a second year at University of Texas Health Science Center at Houston, and I was placed at El Centro de Corazon in Houston, Texas. The objective of this study is to identify decision-making factors when considering the use of the contraceptive implant. It is my hope that these research findings will aid El Centro de Corazon and patient education regarding the contraceptive implant and its use. The methods used in this study was initially was a patient encounter. The participant was asked if they're interested in contraceptive methods or are currently using those methods, and if they answered yes, then they would be asked if they would want to watch a short educational video on the contraceptive implant and take a short 14-question participant survey. Next is the key findings. The major decision-making factors identified were the side effects of the product, including, but not limited to, irregular bleeding and irregular menstrual cycles, the popularity of other less effective options, most specifically the Depo-Provera injection and the oral contraceptive pill. Next is education on the contraceptive implant. It seemed on the survey consistently that the participants sought after more education on the contraceptive implant. And lastly is the price of the contraceptive implant. Recommendations for future studies is implementation of contraceptive education. I think will be very beneficial for the patient population at El Centro de Corazon and all patient populations. Next, I believe there should be an effort to popularize the contraceptive implant option in the community. So that could be through posters, through flyers, through informational sessions and the like. And lastly, I think the Nexplanon/Implanon, the contraceptive implant, should be offered free of charge to women in federally qualified health centers. Alrighty, thank you for your time.
Hi, my name is Andrea Lewis, and my project is entitled Perceived versus Accuracy, a comparison of patient-perceived STI testing versus actual tests performed in a community health center. My project was completed in San Antonio, Texas. Recent data from the CDC estimates that in the United States there are currently 100 million individuals infected with at least one STI and about 20 million new infections each year. In order to prevent and control the increasing amount of individuals with STIs, the CDC recommends that healthcare providers inform patients receiving STI testing of all the STIs they are being tested for and also the common ones they aren't. Previous research that looked at young women aged 18 to 24 found that patients presenting to physician offices for STI testing have a general misunderstanding of STI screening procedures. This misperception presents a major public health problem as patients attempt to take responsibility for their sexual health. The purpose of this study was to determine whether patients referred to the on-site LabCorp could accurately identify which STIs they had been tested for during their visit. In order to complete this project, I recruited patients receiving STI testing that included at least one blood test that could be either STI related or not during the study period. Patients were recruited at the end of their visit and provided with a consent form and 8-item questionnaire that elicited demographic questions such as age, gender, race, and education level. Additional questions included the reasons for the participant's visit to the clinic, which STIs the participant had been tested for during their visit, the referring provider, and whether the participant's concerns had been addressed by the clinic staff. To ensure privacy, participants were instructed to place completed surveys in a Dropbox to which only the patients and I had access. All clinic staff directly involved with the treatment of patients was blinded to the purpose of the study, survey content, and responses of participants. Surveys were linked to patients' charts through a number provided to patients during check-in and listed on completed surveys in order to assess which STIs tests each patient received. Descriptive statistics, frequencies, and other data were analyzed using 2011 Microsoft Excel. Key findings included majority of respondents were Hispanic females between the ages of 25 to 34 years old with at least a high school diploma or GED. 66% of respondents stated either they weren't tested for STIs or they did not know that they were tested for STIs, but in actuality, they were. Only 10% of respondents were able to identify all STIs they had been tested for during their visit. Additionally, majority of respondents indicated the reason why they got tested for STIs was due to a provider referral or recommendation. Furthermore, the most commonly tested for STIs were HIV, gonorrhea, and chlamydia. The results from this project support previous findings that patients are unaware of STI screening procedures. It also reveals that healthcare providers should inform their patients receiving STI testing of all tests performed as well as those that are not. My recommendations for this community health center is that educational efforts should be put in place to inform healthcare providers of CDC recommendations and importance of patient education regarding STI testing. Additionally, studies should be performed after training of healthcare providers to see if the efforts targeted at providers result in an increased patient education and knowledge of testing status. Thank you.
My name is Anthony Peterson, and I'm a second year at Arizona College of Osteopathic Medicine. Reinforcing chlamydia screenings in most at-risk females. The objective was to complete an evaluation of chlamydia screenings in most at-risk females because screening rates have dropped significantly recently. In most at-risk females is any women between the ages of 14 and 25. Methods: reinforcing the importance of chlamydia screenings to medical staff and providers at Wesley, observing clinical environment screenings of most at-risk females, evaluating the patient database for chlamydia screening history. Some key findings were that the original chlamydia screening rate was not accurate. The original audit said that the screening rate was 20%. After reevaluation, the new screening rate is at 66%, and then the most recent audit poll showed that screening rates were up to 75%. So the screening rates are increasing over time. Recommendations: make sure all most at-risk females are being screened yearly. Discuss protocol collecting samples between the medical staff and providers. Regularly compile, audit, and evaluate the results, and to educate the public.
Hello, my name is Jaylene Sims, fourth-year medical student at Southern Illinois University School of Medicine. My site was Central Mississippi Health Service in Jackson, Mississippi. The name of my project was Evaluating Effective Messaging for HPV Vaccination Promotion. My objectives were fourfold: to learn the most effective or preferred promotional message out of 4 educational documents regarding the HPV vaccination, to gain insight on how to better educate the public about the HPV vaccination, to discover if health literacy plays a role in the effectiveness of HPV vaccination promotion, and through my findings to Central Mississippi Health Service to help them develop effective brochures and increase the rates of HPV vaccination administration. Here are the methods I used. 3 HPV vaccinational promotion documents from the CDC and 1 visual image of cervical cancer from Google Images were assessed for their health literacy level using the SAM tool. Each fell into 4 commonly used strategies of health promotion. They include educating about a disease and prevention, correcting misperceptions, use of dramatic narratives, and use of visual images of diseases. Focus groups and individual sessions were held, and participants were asked to do the following. Rate the effectiveness of 4 educational promotional documents regarding the HPV vaccination, and to provide advice on how to effectively promote the HPV vaccination. Lastly, the newest vital sign, which is a health literacy assessment tool, was used to assess participants' health literacy level, and then those literacy levels were compared to the most selected document. The key findings. More than 70% of the participants reported that they were more likely to obtain the vaccination for themselves, their child, or their grandchild after reading each of the 4 documents provided. However, it was suggested that a combination of the documents would enhance the promotional effort. The picture of cervical cancer and the facts sheet about HPV and the vaccination was the most commonly suggested combination, with the third one being the narrative. The most commonly suggested locations for promotion were churches, health fairs, schools, and doctor's offices. They suggested that we should hit this very hard, similar to how we do for diabetes, hypertension, and cholesterol. According to the quantitative data, health literacy did not play a role in the documents selected. However, recommendations made by the participants, such as using more color and more pictures, did suggest that health literacy does play a role in becoming more effective in the promotional effort. Based on the study, here are the recommendations. We should use at least 2 public health strategies when developing documents to promote the vaccine. Promotional efforts should be expanded to include education at churches, schools, and health fairs. And lastly, healthcare providers should discuss HPV, what it is, how to prevent it, with all young patients and their guardians when they present for annual physical exams. And this recommendation was based on the fact that each time I spoke to someone in an individual session, I would start off by asking them if they knew what HPV was. Most of them said they had no idea, never heard of HPV. In addition, when I was in a focus group, one of the individuals mentioned that they talked about HPV at their church, and they said that none of the individuals that she had spoken to knew anything about HPV. So I thought that this would be a great idea to just mention it in a normal visit, even if it's not for vaccinations. Thank you for your time.